For us as a team, because it was directly related to our patients, it made it not seem like a punishment. We live in a really small community, and you walk into a restaurant and you know everyone there. And so I kind of feel this, like I owe it to these people that I'm going to see at the coffee shop on Sunday to take care of them and take care of their families. Because you see them all around town, and I don't want to hang my head when I pass them in the store.
Rising above the buzz of ultrasonic cleaners and the clanking of stainless steel are the ideas and voices that are changing an industry. You're listening to the Beyond Clean podcast, the central nexus for the people, processes, and products that are improving our sterile processing world. Each week we speak with frontline technicians, CEOs, engineers, and entrepreneurs with a common goal to help you fight dirty. Every instrument, every time. Whether you're tuning in for education or inspiration, we're glad you did. Now turn on those washers and turn up the volume. It's time to go Beyond Clean.
This week on Beyond Clean, we speak with Amy Davis, Director of Surgical Services, Christy Clark, Director of Quality and Patient Safety, and Laura Clark, Compliance and Accreditation Officer at Minidoka Memorial Hospital. Amy Davis is a seasoned healthcare professional who maintains dual licensure as an RN and CRCST. She spent 22 of the past 25 years as the Director of Surgical Services at Minidoka Memorial Hospital. She's a proven and compassionate leader, and Amy has captured buy-in from her staff and instilled a culture of supportive teamwork. She's passionate about the patient experience with focus on the safe and efficient delivery of care and continuous improvement. Amy has taken her team to the next level of excellence, DNV certification of the Sterile Steam program, achieving 0 findings from the 2021 DNV survey and a data-proven record of 0 hospital-acquired infections for over 3 years. Christy Clark has over 13 years of experience as a healthcare professional and a clinical representative on a subsidiary board of the Idaho Hospital Association, and she's passionate about continuous quality improvement and optimizing the delivery of safe and efficient patient care. As the Director of Quality and Patient Safety at Minidoka Memorial Hospital, Christy has successfully implemented unique initiatives to improve the quality of patient care and leading continuous improvement programs. In partnership with other key leaders, Christy has championed the hospital's transformation to a data-driven environment, strengthening data collection and information capabilities of the organization and instilling a sustainable culture of continuous improvement and excellence. And finally, Laura Clark, a summa cum laude graduate of the University of Idaho. Laura began her journey in the healthcare profession 16 years ago. Physician leaders fueled Laura's passion for a culture of clinical excellence, optimal patient care, and continuous improvement. As the Compliance and Accreditation Officer, Laura's expertise in process improvement, regulatory compliance, and program document development have proven instrumental in the success of the hospital's digital transformation and growth of the accreditation and document management programs at Minidoka Memorial Hospital. In collaboration with other key leaders, Laura successfully guided the expansion of the accreditation program to include certification of the sterile processing program, furthering Minidoka's commitment to a sustainable culture of continuous improvement and excellence. And that's what we're here to talk about today, Hank. Really 3 themes in there, talking about sterile processing, talking about achieving 0 hospital-acquired infections over a period of time. So that means sustaining it as well, that DNV certification. So this commitment to excellence and this commitment to 0 is what today's episode is all about.
Well, in collaboration, and I think that is likely to come up in this conversation because we've got a crowd tonight. We got 3 guests on the show with us, all from different perspectives and all from different backgrounds, but all with the same goal in mind. And that theme, as I said again, of collaboration is going to draw us through how do you get from a challenge to a success. Well, you don't get there by yourself. So I'm excited for the ladies tonight to tell that story to our audience.
All right. Well, we're going to be right back with Amy, Christy, and Laura after a short break.
You're listening to Beyond Clean, the global voice of sterile processing.
Joining us now is Amy Davis, Director of Surgical Services, Christy Clark, Director of Quality and Patient Safety, and Laura Clark, Compliance and Accreditation Officer at Minidoka Memorial Hospital. Really excited to have the three of you on this episode and really to talk about your commitment and ongoing commitment to a zero infection rate. So thanks so much for coming on the show.
Thank you for having us. We're really excited.
So before we get started, I want to let the listeners in on how we got connected because I host another podcast called First Case, really centered around the OR. And one of the co-hosts there is Jeremy Gibson-Roark, who is a surveyor for DNV. And I know that you earned the DNV SPD certification, so I want to congratulate you on that accomplishment. But one thing that I didn't know as we were talking and getting ready to record this interview was that you recently won an innovation award. And the reason I tie that together with DNV is as an accreditation organization, DNV draws from multiple different industries. They're not just accrediting in healthcare. You were telling me that the innovation award that you won was about using technology that is in other industries, but not really predominantly used in healthcare. So I thought maybe you could share that experience with us before we dive into really the process of getting to this zero infection rate commitment.
Sure, we can speak to that. It was about 2 years ago. We were asked to submit an application for the Innovation Award, and that's through Verdantix. It's an international innovation award, and we ended up submitting an application. In our category, there were several, and these are all large corporations. Merck was one of them who we were going up against, and we won the award and went to Atlanta and accepted the award on behalf of the hospital.
Excellent. Well, what a cool story. And I think you said you traveled to Norway and really got to have some fun experiences along with that. And anytime you do something, I know we're going to be talking about excellence today, but I think it's important. Part of excellence is really just trying to drive and attain something that sometimes is unattainable in a way. And that's where innovation always comes in. It's not only, in this case, we're going to be talking about your commitment to zero, but there's also just a commitment to always striving to do better. And I think that innovation was a great way to tee that up because we don't always think about innovating as healthcare providers as much as we think about innovating as maybe a company or a new device or a new product. And so again, I really want to congratulate you on that success. So let's start at the very beginning of your process in developing this journey towards getting to an infection rate of zero and continuing to manage that on an ongoing basis. Where did this all start for you and your team?
Honestly, it started for me as the manager of surgery and SPD right after our first survey in 2018 with DMV. I received the hospital's only condition level finding for the way we were processing using IUSS, the immediate use steam sterilization. We were misusing it in a way that they deemed was a danger to the patient. So we received the condition level finding for that. And that kind of opened the door for me, the importance of what we're doing back in SPD, behind locked doors, behind closed doors. When I started in surgery, we had a gravity sterilizer that didn't even have ticker tape. It had the disc of paper with the little needle that etched across that outlined the parameters of that sterilization cycle. So I had learned a lot along the way, but didn't really understand the importance of different cycles and following IFUs and really deep diving into the decontam process and the pack and prep process. We were sterilizing everything on the same cycle or using IUSS. So getting that condition level finding really kind of opened the doors for me. In formulating the corrective action plan, I really learned a lot. And I learned about how many things that we were doing wrong and what processes I need to put into place to stop that. I had a lot of support from people around me and administration support and my staff support. But taking it back to the beginning, that's what started it all for me.
I love that story about the conditional level finding, even though, that's not a good process to go through. But that's where so many improvements in our industry start. And the statistic out there, like I don't know about the D&V certification process or their accreditation process, but I know for Joint Commission, a large percentage, like 70, nearly 75% of their findings are still to this day focused in sterile processing. And for a lot of sterile processing leaders, it almost takes that oh crap moment to get a collaborative team together to make changes. Not that, collaboration hadn't already been in works, but until you have that finding, until the back is up against the wall, there's a lot of excuses that can be made. There's a lot of other priorities that can be pushed forward. But when that finding is in front of you, you have no other option than dig in to really find the root cause of what's going on. And so I just find it encouraging. I know we haven't even told your whole story yet, but for folks who are listening to this thinking like, oh, the last thing I want in the world is to have a finding when these surveyors come through, that actually might be the best thing possible for your department is to be cited so that you have nowhere else to hide.
Yeah. And it opened up so many more doors that were opened up because of that. And it just started with IUSS.
So let's connect the dots here, because one of the systemic questions in our industry is, what does sterile processing have to do with the infection rate? I know your citation, as you mentioned, was focused on IUSS, but in taking it to the next level, like, you could have solved that problem. There's no reason that you had to go beyond and say, okay, it's fixed, like, we're clear, everything goes back to normal. What step, what reason did your team kind of come up with to say, hey, this is our opportunity now to build on this momentum and continue making changes and actually get to this goal? Like, what drove that for your team?
I'm embarrassed to say it might have been kind of an accident. When we started researching, after we got our finding, we started researching about the IUSS. We bought books, we started listening to podcasts, and we really started researching the whole SPD realm. And the more we learned and the more we researched, the more we sat back and went, oh my gosh, we're not only out of compliance for this, but we're out of compliance for some other things too. Like, we were doing a good job. I want to say we were doing a good job because our hospital-acquired infections have never been, skyrocketed off the charts. But really kind of researching how to put into play our IUSS corrective action plan opened up the doors of a lot more things that we could really tighten up and do a lot better.
It seemed like the next natural step anyway, because part of this is that continuous improvement. And Amy has a great team. So it was kind of a little bit of a nudge. You know what? We're making these changes. Your team is doing great things. Let's take it to the next level. And they've done a wonderful job.
We just had a episode where we talked about corrective action and how sometimes that can be viewed more as like punishment. And it really speaks to the culture that is in an organization, how they approach corrective action. And I wondered if you had any additional thoughts on just how you were able to take that corrective action and really make it constructive instead of destructive for the culture.
For us as a team, because it was directly related to our patients, it made it not seem like a punishment. We live in a really small community, and you walk into a restaurant and you know everyone there. And so I kind of feel this, like I owe it to these people that I'm going to see at the coffee shop on Sunday to take care of them and take care of their families. Because you see them all around town, and I don't want to hang my head when I pass them in the store. So bringing in that personal patient experience, that made it feel not like a punishment. Like, we're going to do this for our people.
And we truly do. We really focus on the process and how can we make our processes better so that flows to an enhanced experience for our patients. We all live here in the community, and we take a lot of pride in what we do. And we've done a lot of really good things, and we should get it out there and let people know that this is where you need to come.
You know, that commitment to your community, we hear people say this all the time, right? Imagine if it's your loved one that's going to be on the table, and we rally around that. And I don't want to call it a cliche because I think it is powerful. And I want to continue to hear that perspective whenever we're talking about innovation and improvement in the industry. But you just kind of took that saying that you hear at a lot of presentations, and you really took ownership of it. Like you said, I'm out in the community. I'm having dinner. I want to hold my head up high that this community that I'm serving is getting the very best and it gets what it deserves. And I think you painted that picture in a very different way than you sometimes hear it. And I think it's really important to acknowledge that sense of pride, but also responsibility. So when we talk about making improvements like this, right, multiple teams, departments have to get involved, administration has to get behind it, because I'm sure that this didn't come for free, right? When you start to make these changes, that didn't cost nothing. And so you got to pay for it. Yep. And you got to get people on board. So talk about getting that sort of alignment and collaboration across different departments and up the chain.
You know, it's definitely a commitment from all levels. Our administration was completely right on board when we told them what we were wanting to do, and we had Amy on board and quality on board, accreditation. We went to them and just talked a little bit about, you know, how this would better serve our patients. And that's all that they needed to hear. There's no financial benefit for the hospital for us to get this certification. It is all towards our patients. It's all our commitment to make sure the sterilized items are getting to the bedside, and we are committed to that zero infection rate.
I want to go back to something that we said earlier, and even something that Justin brought up. It just happens to be one of my favorite topics in the whole industry, right? So I'm going to be selfish here and I'm going to go back to it. That question around the connection of infections to what happens in sterile processing, because there are so many contributing factors, right? It's very hard to say it was sterile processing in this instance or it wasn't. So I admit that on the front end. But in the story, even about y'all being out in the community and seeing the faces of your patients, that number is not just a percentage point anymore, right? It is a person. It's not just a benchmark anymore that, oh, hey, like, we're better than the national benchmark, because there's still a number of percentages there that mean that there's real people that, yeah, you're having dinner with, that you're seeing the coffee shop, that you're going to church with. That's a powerful engine, I think, to drive commitment, not only for y'all, but I want to bring this up for the audience of this podcast to say, in our industry, as an industry, we should not be satisfied with only meeting the benchmark. Our entire industry should have a commitment to zero in the same way and for the same reasons that you do. And if that means that you need to view your place in your facility more in that community mindset, I think it's probably easier in the smaller setting as you are. As you said, like, you're in a small town, you know everybody, you see everybody. In these large metropolitan areas, like, that can be a challenge, but it doesn't make it any less real. I think the farther that we move away from that connection between, even if we can't prove it, we know that safe and sterile instrumentation is the expectation of every patient that comes into our facility. So regardless of if it shows up in the data, we owe it to them. And somehow we have to get there.
Mm-hmm. Absolutely.
Yeah, and you mentioned the data. We do a lot of tracking, a lot of trending. We look. Oh boy. It's, we have to uncover where we're not doing so well so we can get better. We had the finding with the IUSS a couple years ago, but we're continually trying to improve. I think Amy can talk a little bit more to the IUSS process, how we've related it back to the patient.
Yeah. Can you speak on that topic in particular? Because it's such a hinge point in this conversation. Like, let's use that to go through some of those tangible changes, because iOS is a challenge all over the place. It still is, years after it was on the top list of, the collaborative statements from ARN, from Isham, from Amy. Everybody's been targeting iOS for a long time, but just still confront it with a strategy, changes and updates and training. Like, how did you go about that? Like, what are those concrete things that you did at the beginning and through that process to actually impact your goal?
So the first thing that we did is very simple. We put a log. We didn't have a log for IUSS. So we created a log, of course, with the 4 approved reasons why one might process something using IUSS. And it's some of our batteries we have to process using IUSS because we're following the IFUs. They can't withstand the dry time. So for every time we process using IUSS, we, of course, have the patient's information. We take down the information, of course, what we processed and why. But one of the things that I'm the most proud of, and again, I have a very small staff, so it's easy to pass this information along to them. We can do it in something as simple as daily huddles. So they're all on board and they all have buy-in. And so at the end of the month, I take all of those and I kind of log them into this computer system that we have called Synergy Life. And that's what Laura was talking about earlier. And Synergy actually allows me to stay very organized in keeping those logs. And so I assign myself actions with this computer program to, in a couple of weeks, reach out to you as the patient and call you and just to kind of see how you're doing. Because we use something in your surgery that was processed using IUSS, we kind of put you on our call list. We want to check up with you and make sure that everything's okay. And that's something that I'm very proud of, that I circle that back around completely back to the patient. That may have not been my idea, but I do it.
So let me ask a follow-up on that. The patient's not aware of the reason that you're calling them, right? They're just aware that you're calling them for a checkup, but you're doing so because of that commitment to make sure if there is no fallout on the data that you know what's going on when you use IUS.
Right. Exactly. And no, they don't know why I'm calling. My goal is to call them before they get their bill.
Consumers in general are expecting this now.
Yes.
And it's been a big move. And again, not limited to healthcare. People expect you to be more proactive and much more customer service oriented in that way. Even when you just look at online shopping and, I think of sites like Amazon, but then I think of platforms like HubSpot, and their whole thing is make sure you delight your customers. And this is a big movement towards improving the consumer experience in our whole society. And I feel like you really took that to heart and applied it in a very nuanced situation.
Thank you. All of our patients, they get phone calls the next day just to kind of to check on them. But this phone call does happen a couple weeks later. See if they're going to cook an infection. How's your wound look? How's your dressing? How's therapy going? And so the timing of the phone call is a lot of it too.
You know what that reminds me of? If you think back, I think it was maybe 2011, 2012. They did, I'll call it an expose, but it was 5 minutes on the Today Show in the morning. And then NBC Nightly News did a 2-minute one. And there was a gentleman who had a shaver that was not cleaned correctly and wound up getting a debilitating infection from a shoulder surgery. And it might have been a shaver. But either way, he got a debilitating injury and struggled to recover. But one of the things I remember that was part of that story was that he didn't seek treatment. And so, he's kind of a tough guy, I think, and really did not come in when he should have. And yes, he still would have had the infection and there would have been repercussions for that. But had he been reached earlier, maybe the debilitation wouldn't have been as bad, or maybe he would have made a better recovery. And so just what you're doing is so important because we think sometimes as healthcare from a very healthcare centered perspective. Everybody knows this because everybody I know knows this. Yeah. And, making that extra effort to reach out and make sure you capture that before maybe a problem, before it becomes a major problem. So again, there's multiple purposes there, it's not being consumer centric just for the sake of getting a good HCAP score or something like that. It's about truly, impacting the patient experience and not just when they're with you. And I think that's what accountable care was really all about. Like, I feel like you're living that to its ideal, not necessarily always its application.
Mm-hmm. Something that's really stuck with me in quality, they say, if you're claiming 0% infection, then you're either really good or you're not digging deep enough. Mm-hmm. So this is one of the ways that we can just dig deeper to prove that we are a 0 infection rate.
Yeah, you're not afraid of the data was something that I gleaned from what you were laughing when you said, oh yeah, we love the data. And I was, but some people are afraid of data, and that's definitely an obstacle to continuous improvement. Just because you get data doesn't mean it's always accurate data, but you got to work it. And that's part of that process. I want to talk a little bit too, because a lot of this conversation is gathering the data, et cetera. It's management level, it's leadership level, it's strategy. And I want to talk about how the role of the leaders in the process was in comparison to the frontline technicians and what they did. Because sometimes what happens is, oh, that's not my job, right? And not because they necessarily have a negative attitude, right? My most unfavorite statement these days is that's above my pay grade. That always bothers me. I bristle against that when I hear somebody say that. And it may be above your pay grade to make the decision, but it's not above your pay grade to understand it and to try to do something, with that situation. And so I kind of wanted to talk about, yes, there was a leadership and a strategy and a process and the citation, but how did the team of everybody's doing the job on the front line come together, and how was their role different from what you were doing?
Well, their role is very different than mine because they're in it all day long. I'm in and out, in and out. I have spent a tremendous amount of time at SPD because I really enjoy that and I love that. In and out at times of my career, that's where I've had to work due to staffing. So I learned a lot about it that way. But I have one tech. She's actually an LPN that is trained as a technician, and she just jumped in with both feet. So even though she wasn't really in that leadership or that management role, she really just kind of took it all, and she did a ton of research, and she really got the rest of the girls' buy-in. But a lot of it is I was right back there with them along a lot of the way. Okay, we're going to implement this log, and we're going to implement this, and this is how we're going to do it, and I'm going to do it with you. And so I spent a lot of my free time, instead of being out in the hospital or in other areas, I just really kind of planted myself in SPD. It seemed like for a year. 6 months to a year. And I would write down what the patients were saying, and I would let them know, like, this is what people are saying about us. You girls have the ability to change people's lives with either doing something correctly or incorrectly. And they live in this small community too. But really it was that lead LPN that really just kind of took it, and she got everyone else's buy-in. But I think just my presence there helped a lot.
Well, because you weren't afraid to get your hands dirty. And I mean, that's really leading shoulder to shoulder instead of leading from, hey, this is what you got to do, go make it happen. It's totally different.
Yeah. And I think that's also one of the things that may be unique about our facility is that we're a team and nobody goes through it alone from the top down. I think everybody jumps in and, how can we help? I'm not clinical, but I can help in other ways. And so to have that support and to know that this is about providing the best possible care that we can. And Amy does a great job. Her team, the team that she's assembled, they believe it, they live it. And I think that makes a huge difference into the success that she and the department have been able to have. but also to have that support to know, hey, you're not in this alone. We're with you every step of the way. So we'll all take our part and we'll shoulder and go forward.
Yeah, right. Well, any leader will tell you that you cannot do any project just with the leader. You need someone to implement.
Right.
And if you don't have team members on your team who will own it themselves, like that LPN that you mentioned, and catch the vision, it will not succeed. If you do, not only will it succeed, but it will actually go better than what the leader originally planned, because now you've got other folks who are contributing their own strength and their own insight and their own additional perception on the challenges, and it just gets better. But this goes back to the huge importance of having high performers in sterile processing, to not treat that department as, oh yeah, anybody can come in here. Like, we'll just take anyone off the street, plug a hole. Like, we need a warm body just to push things through. No, we need critical thinkers who can really meet those high level challenges. Like Justin said, there's nothing that's above the pay grade in terms of understanding. You have to be able to connect the dots. And once you do, there's endless possibilities out there for how you can improve the process. And I think, your story really highlights that.
Thank you.
One other thing that I wanted to throw out there too is that Amy and her team, when they problem solve, they think outside the box, because we're also very cost conscious and want to keep our costs down so that we don't have to pass on any additional cost to our patients. We want to keep that care as low as possible. And Brooke, the tech that Amy was referring to, has really done a good job being able to problem solve and to think outside the box without having to spend a lot of money. She's just, and that's her team. Brooke's one example, but the whole team is really great at that. And I think a lot of that is due to Amy's leadership as well.
Thank you.
If you're auditioning for another episode on how to save your department money, you have succeeded. And we'll bring you back to talk about that too, because that's going to be a hot topic, right? Good. But for today, I do want to touch on, like, we started this story on kind of a down note of, we got this citation and this kicked it off. And so that honestly and obviously would have had a negative impact on the team, because no one likes to be told that they have failed. Even though, like, you can see the opportunity in there, that's not a good feeling at the beginning. But in succeeding, that also has its own impact. So can you talk about, in this journey and at the end of this journey, the success that you've had, how that has impacted your sterile processing team, their perception of themselves, the perception of the community, of the administration towards sterile processing? Just kind of walk us through all the implications of actually arriving at your goal.
Boy. I think the first kind of happy news that we got was our resurvey. They came back in 60 days to kind of check our process and see how we were doing. And we nailed that resurvey. We really did. They
were surprised.
Yeah. And so that was the first thing when I went back to the crew, and I'm like, what we're doing is good. It's been accepted. We need to keep doing this and be very diligent and be militant on our logging and on our data. We did that for a year. And then DMV came back for their annual resurvey, and they closed that finding. They closed it. And so that was silver lining, happy moment number 2, is they closed that finding. So that's about the time that we thought, we're getting really good at this. Somebody mentioned the sterile processing certification, and I thought, we're going to be a slam dunk for that. Let's sign up. It wasn't that easy.
Are you kidding me? She was like, oh, no. Yes, you guys are doing this. It's a next natural step.
To answer your question, though, it wasn't really like a written out process of how we got everyone's buy-in and how we kept getting better. It was a very slow process, and the more out of girls we got, and the more, the resurvey was good, and the 1-year resurvey was good. Everyone's buy-in, it just kept getting better and better. because they felt validated and they felt important and seen.
So as we wrap up this interview, this has been a story, really of inspiration, right? And I know you want to share that inspiration with the audience. You want to empower them to impact their communities and to rally around, this goal and this commitment. So what would you do, or what would you say to other departments out there who maybe are, not 2 years later, but are in the shoes you were in several years ago? What would you say to inspire them? Or maybe it hasn't happened yet and they don't have the benefit of the fire being lit under the organization to really get them to move. How would you inspire them to start making those kinds of changes now?
So I would say that it's not an easy journey. Our very first survey, like Amy said, we had 9 findings. 9 corrective action plans is not easy to manage. But Amy not only managed those corrective action plans for the sterile processing department, but we were able to apply them to other areas in our organization and improve throughout. So what she got dinged for in her area, we found that it was going on in more areas than just sterile processing. So 1 survey and 9 findings, we've really made an impact through our entire organization.
And the other piece I think I'd like to add to that too is, how can you go wrong? Because it's always, if you make the decision always with the patient in mind, why would you not? Why would you not take that extra step? Why would you not? Because who knows, maybe the patient's going to be you tomorrow. Maybe it's going to be somebody that you love. And that really, really hits home, I think, and is really inspiring for all of us that it's not about you and it's not about me. This is about what's best for our patients and for our community. And our team rises to the occasion.
To add to that as well, what I would tell other departments or other hospitals is that these team members, these girls, I call them my girls, they work behind closed doors and nobody sees them. Nobody knows what they do. Like, here's your moment to shine. And here's your moment to bring attention to what you do every day and the importance of what you do every day.
You're preaching to the choir there. Amy, Christy, Laura, thank you so much. And congratulations again for everything that you've accomplished, and even the surprise that I didn't know about, the Innovation Award, which we used to lead off this interview. But you should be very proud of the work that you've done, and I appreciate you sharing your story with everyone else.
Thank you.
Thank you so much.
That was Amy Davis, Christy Clark, and Laura Clark from Minidoka Memorial Hospital in Idaho, talking about their commitment to a 0 infection rate and the process that they went through. And, Hank, I kind of pressed them to be an inspiration to our audience. And I know the story is, but I wanted some inspirational words. I wanted set that goal, set that bar high, and tell people why they should care. But at the end of the day, they really already answered the question. People should care because they care about their community.
That's right, Justin. And I love the takeaway of how those sterile processing technicians in this department saw the value of reaching that goal. We talked about it very briefly, but I think it's so important. We heard about the ownership of that one technician who saw the goal and knew that this has got to be implemented in order for us to reach there, and pressed it and led the whole rest of the team all the way there. Like, that kind of story happens all over the place in departments all the time, but we don't get to hear it on this kind of platform, and we don't get to see that ultimate goal. Like, that 0 infection rate is a tremendous achievement and success. And to have sterile processing so engaged with it, I mean, I love the story, and I think it is going to be an encouraging story for a lot of folks out there who are just struggling to say, what do I do? Like, where do I spend my limited amount of time and effort to improve the department and the facility? I think really you need to be focusing on that infection rate, and don't settle for the status quo. Don't settle for the benchmark. Shoot for 0.
All right, well, that's going to do it for this week's show. As a reminder, you can help support Beyond Clean by subscribing on Apple Podcasts, Stitcher, Google Podcasts, Amazon Podcasts, Spotify, or your favorite podcast application, or by downloading our smartphone app for iPhone and Android. We'd certainly appreciate a rating and a review because your feedback is important to the show. And if you have any topics, or I'll even add success stories like today's that you'd like to share on a future episode, just send an email to info@beyondclean.net. On behalf of Hank and myself, thank you for listening to this week's episode of Beyond Clean.